Welcome to Crisis in Perception, where we examine the systems shaping our world.
It's really good to be back for this one.
Today, we are doing a deep dive into something that, honestly, I didn't think I needed a deep dive on. I'm talking about that little line of text on your cereal box or, your bag of flour, fortified with iron, added vitamin D.
Right. Enriched.
Yeah, exactly. It seems incredibly mundane, doesn't it? Just part of the background noise of the grocery store.
It does. It's totally normalized for you.
Totally. I mean, in my head, the narrative has always been very simple. Scientists found out we were getting sick.
Mm-hmm.
Maybe we had rickets or scurvy or something, and the government cares about us, so they told the food companies to sprinkle some magic health dust on our toast. End of story.
Right.
It just feels, it feels benevolent, like a bonus level in a video game for your health.
Well, that feeling of benevolence,
Yeah.
that is exactly the surface layer. That's the marketing. But the document we're analyzing today, it really takes a sledgehammer to that idea. We're looking at Mark Lawrence's institutional analysis.
Right. The book is called Food Fortification, Evidence, Ethics, and Public Health Policy. And just as a reminder for you listening, this is not a book review. We use books as entry points. Our focus here is the underlying systems.
Exactly. Our mission today is to map out the institutional framework of how nutrients actually get into our food. Because it's not just a doctor writing a prescription for the country. It is a massive intersection of biology, global trade law, and, honestly, political philosophy.
And reading through these sources, what I found wasn't a heartwarming story about public health saving lives. It was a story about trade lawyers, global bureaucracies,
The
and
corporate lobbies?
yes, and how we might actually be engineering a food system that, in a way, needs us to be sick so it can sell us the cure.
That is the core tension Lawrence wants us to look at. Is adding vitamins to food a triumph of public health, or is it just a technical Band-Aid? A Band-Aid that allows structural poverty and poor diet quality to just persist.
Are we solving the problem, or are we just profitably managing the symptoms?
Right. The concept he explores is hidden hunger.
Which is micronutrient deficiency.
Exactly. Versus the hidden systems that are aiming to fix it.
We've got a massive stack of research to get through.
Hmm.
We're going to break this down logically. We'll look at the design of this architecture, the incentives driving it, the predictable outcomes it produces.
And why it persists so stubbornly.
Yeah. And finally, the interconnection with the global economy. So let's jump right into the design, the institutional architecture.
Let's do it.
When I was reading the section on who actually writes the rules, I had this naive assumption. I figured if, say, the UK or Brazil wants to put folic acid in bread, they just do it. They pass a law. Done.
You would think so.
Yeah.
That's a very state-centric view of the world. It assumes the nation-state is the ultimate authority within its own borders.
Which makes sense, right?
Sure, but Lawrence points out we don't really live in that world anymore, at least not for food policy. We live in an era of global health governance.
Which is basically a fancy way of saying there are a lot of cooks in the kitchen, and some of them are way bigger than the countries themselves.
Exactly. The head chef isn't your local government. It's this complex web of actors. So you have the WHO, the World Health Organization, and the FAO, the Food and Agriculture Organization.
Okay, everyone knows them.
Right. They're the scientific bodies. They generate the evidence-informed guidelines. They do the risk assessments. They're the ones who say, biologically, humans need 400 micrograms of folate.
That makes perfect sense. Science leads the way. They set the biological goal.
They set the goal, yes, but they don't write the recipe for global trade. That job belongs to a body that I bet most people listening have never heard of, but it essentially dictates the global food supply.
The Codex Alimentarius.
The Codex
I
Alimentarius.
just love that name. It literally translates to the food code, right? It sounds like something out of a Dan Brown novel.
It does have a certain mystique to it. It was established by the FAO and the WHO back in 1963. Its official mandate is to protect consumer health and ensure fair practices in the food trade.
Okay.
Now, technically, and you're going to hear this word a lot,
Mm-hmm.
Codex standards are advisory. They're just recommendations.
Advisory. That sounds so polite, like a suggestion box. Hey, it would be cool if your flour had this much iron.
Right, but in international law, advisory is kind of a trap.
How so?
Because of the World Trade Organization, which we'll get deep into later, Codex standards effectively become the global benchmark.
Mm?
If Codex says standard flour should have X amount of iron, and you're a country that wants to do
Oh,
something
you better
better.
have a massive team of lawyers ready.
Exactly.
So if I can use a metaphor here, it's almost like a homeowners association for the planet.
That is a fantastic analogy.
Right. The HOA guidelines technically aren't state law, but if you paint your house the wrong color, or in this case, if you try to sell flour that doesn't match the Codex standard, you get fined, you get sued, and you eventually comply.
Precisely. The Codex is the global HOA. So the real question becomes, who sits on the board of this HOA? Who's writing these advisory rules?
It's not just doctors, is it?
No, not at all. It is heavily influenced by the food industry. Lawrence categorizes these actors. You have the UN agencies, obviously, but then you have the NGOs. And he splits them into pingos and bingos.
Bingos and bingos. It sounds like a clown show.
I know, but it stands for public interest NGOs and business interest NGOs. And the bingos are massive players here.
Give me an example.
If you're a transnational corporation that sells vitamin premixes, the actual synthetic powder that gets dumped into the flour, you make very sure your voice is heard at Codex.
Because that's your product.
Right. You lobby. You provide, quote, technical expertise. Your ultimate goal is for the standard to require your specific product.
So the design of this whole system isn't strictly about health. It's about standardizing a product for global trade efficiency. Because if every country had different rules for flour, General Mills or Nestle couldn't just ship products everywhere easily.
Exactly. Standardization is the best friend of the multinational corporation. It turns nutrition into a smoothly tradable commodity.
So how does this trickle down to the national level? The global HOA sets the standard, but the national government still has to put it into action.
Right, they operationalize it. And Lawrence distinguishes between two critical types of implementation, mandatory and voluntary fortification.
This seemed pretty straightforward in the text. Mandatory means the government obliges you to do it. Voluntary means they give you permission, but you don't have to.
It's straightforward in law, but the motivations are completely different. Mandatory fortification is usually for high-prevalence public health problems.
Like iodine in salt.
Exactly. The government says we have a crisis, everyone has Goyers, we are forcing manufacturers to add iodine. But voluntary fortification, that's where the government just sets safe upper limits. The manufacturer chooses whether to do it.
And that changes the whole dynamic.
Completely. Because mandatory is driven by epidemiology. Voluntary is almost entirely driven by commercial objectives.
By marketing.
Yes. But before we get into the marketing, we have to talk about the massive shift Lawrence describes in how this is all governed.
The move to public-private partnerships. PPPs.
Yes. In the old days, the government just handled public health. Now you have groups like GAIN, the Global Alliance for Improved Nutrition, or the FFI, the Flour Fortification Initiative.
Which are partnerships between UN agencies, private food companies, and massive philanthropies like the Bill and Melinda Gates Foundation.
Right. And on paper, that sounds incredibly efficient.
You get the money from Gates, the authority of the UN, and the factories and distribution networks of the private sector.
It is the pitch. But Lawrence warns that this creates a fundamental conflict of interest at the structural level.
Because the private sector partners aren't charities.
Exactly. They have a fiduciary duty to their shareholders. So the solutions that these partnerships come up with will almost always favor market-based solutions. They involve selling a fortified product.
Right. They're not going to form a massive global partnership to tell people to go grow kale in their backyard. There's no money in that.
No. If the solution to malnutrition is poverty alleviation or local agricultural diversity, there is no role for the multinational food corporation.
So the design of the system actually pre-selects the solution.
Yes. It filters out social reform and leaves us with scalable commercial products.
Which is a perfect segue into the next part of our roadmap, incentives,
Yes.
the architecture of motivation. Because if the system is designed to favor commercial products, we have to look at the economic logic behind it.
And Lawrence uses a word here that tends to trigger a lot of people, neoliberalism.
Yeah, usually when I hear that word, it's just being used as an insult in a political argument.
Right, but Lawrence is using it very specifically to describe the operating system of food policy.
How does he define it in this context?
He describes a governance philosophy that prioritizes small government and market efficiency above almost everything else.
So regulation is often viewed pejoratively as red tape. The goal is a light-touch regulatory approach.
The belief that the market will solve the health problems if the government just gets out of the way. Exactly. And he gives this specific example from Australia that is just a perfect distillation of this problem.
Oh, the Regulation Impact Statement, the RIS. That part actually made me angry when I read it. Walk us through this. Let's say I'm the Australian government and I want to mandate folic acid to prevent birth defects. I have the science, I have the doctors on my side. What do I have to do?
Before you can mandate anything, you have to prove to the Office of Best Practice Regulation that the monetary benefits of the law outweigh the costs to business.
Okay, which sounds reasonable on paper. We don't want to bankrupt companies with useless laws.
But look at the math involved. The cost to business is incredibly easy to quantify. A flour miller can literally show you an invoice. The dosing machine costs $50,000. The vitamin powder is $10,000 a year.
It's a hard, concrete number.
Yes. Now, calculate the benefit side of the equation. What is the exact dollar value of preventing one case of spina bifida?
How do you even put a price on that?
You have to guess. Use economic models like disability-adjusted life years, dailies. You try to assign a monetary value to human health. But these are soft numbers. They're estimates.
And I imagine corporate lawyers can just tear those soft numbers apart.
Absolutely. They look at the review board and say, their health benefit estimate is speculative. Our business cost is real.
So the math is rigged. The RIS creates this asymmetry where public health has to speak the language of corporate accounting, and it usually loses.
It does. It skews the incentive structure entirely against regulation. So the government often backs off and says, okay, we can't justify a mandate, we'll just make it voluntary.
We won't force you, but you can add vitamins if you want.
Which opens the floodgates for what Lawrence calls the health halo. The health halo. This is the massive commercial incentive for voluntary fortification.
I see this everywhere. You walk down the cereal aisle and the most heavily processed sugary cereals, the ones that are basically just cookies in a bowl, they're the ones screaming 100% daily iron and good source of vitamin D.
And it works. Lawrence cites survey data showing that 80% of U.S. adults purchase foods specifically for those perceived fortification benefits.
80%.
Yes. And here's the kicker. That fortification label influences their perception of a product's healthiness more than low sugar or low sodium claims do.
Wait, really? So I could be holding a box of sugar bombs, but because it says plus vitamins, I actually think it's healthier than plain oats that aren't fortified.
Exactly. It completely hacks your decision-making process. The fortification acts as a halo that blinds you to the junk underneath.
So if I'm a food manufacturer, my incentives are totally perverse. I don't need to make my food actually healthier. I don't need to reduce the sugar, which tastes good and sells, or use whole grains, which are expensive. I just sprinkle some cheap synthetic vitamins on top.
And the consumer rewards you for it. You charge a premium, you market it as healthy, and you don't change your core product. It's the ultimate neoliberal solution. The company profits, the consumer feels responsible, and the government didn't have to pass any red tape.
But is the consumer actually healthier? That leads us right into the outcomes section. Let's look at what this machine actually produces on our dinner tables.
Lawrence walks us through 3 distinct case studies to answer that. And doing a comparative analysis here is crucial because it shows that fortification isn't inherently good or bad. It depends on the evidence and the politics.
Let's start with the one he considers the gold standard, universal salt iodization, or USI.
This is the great success story. Iodine deficiency is a massive public health problem. It causes goiter, which is swelling of the neck, and cretinism, a form of preventable brain damage in children.
And the cause of this deficiency is usually geographical, right?
Yes, that is key. If the soil in your region has been washed out by glaciers or flooding over millennia, there's just no iodine in the crops. It doesn't matter how much spinach you eat. If the soil has no iodine, the spinach has no iodine.
So you can't just tell people to eat better. You can't diet your way out of it.
Exactly. You are biologically trapped by your geography. So adding iodine to salt, which everyone consumes, rich or poor, aligns perfectly with the root cause.
It's a broad environmental solution for a broad environmental problem.
Right. Lawrence notes this has about 70% global coverage now. High public health benefit, low risk, strong ethical justification.
Okay, so that one makes sense. But then we get to case study number 2, mandatory flour fortification with folic acid.
Okay.
And this one gets messy.
This is what Lawrence calls the mass medication debate.
The goal here is to prevent neural tube defects, NTDs, like spina bifida, which are tragic. I think everyone agrees preventing them is a priority. So why is Lawrence so skeptical about putting folic acid in bread?
It comes down to the mechanism of the deficiency. NTDs aren't usually caused because there is zero folate in the food supply, like the iodine situation. They're often caused by genetic polymorphisms, basically metabolism issues in specific individuals.
Meaning their bodies just don't process folate efficiently?
Right. They require a therapeutic dose to overcome that genetic hurdle.
Mhm.
But to reach those specific women, who are a very small percentage of the population, and only during a tiny window of early pregnancy, we decided to put synthetic folic acid in everybody's bread.
Men, children, the elderly, it's a carpet bombing approach.
It is. We are fortifying the entire food supply to treat a highly specific at-risk group. And Lawrence points out, this is not risk-free.
The book mentions vitamin B12 masking. Can you explain that? Because it sounds kind of terrifying.
It is a serious concern. In the elderly, vitamin B12 deficiency is fairly common, and it causes severe neurological damage, tingling, confusion, dementia-like symptoms.
Right.
Usually, doctor spots this early because B12 deficiency also causes a specific type of anemia, changes in the red blood cells.
So the anemia is like the warning light on the dashboard?
Exactly.
Yeah.
But high levels of synthetic folic acid can actually fix the anemia without fixing the underlying nerve damage.
Wow. So the dashboard light goes off, but the engine is still braking.
Perfectly put. The doctor looks at the blood test and says, no anemia, you're fine. Meanwhile, the patient's nervous system is quietly degrading.
So by mandating flour fortification to help the pregnancy, you might literally be sacrificing the neurological health of the grandmother.
That is the trade-off. And there are also emerging concerns about potential links to colorectal cancer progression with high doses of synthetic folic acid.
And Lawrence argues that we have better alternatives, right? Like, why not just use targeted supplementation?
That's his point. Why not just ensure women of childbearing age have access to supplements? Why treat the whole population?
But the counterargument is always, well, people forget to take pills.
Right. The argument is that changing human behavior is too hard. So instead of empowering women or improving the healthcare system to ensure access, we just hack the food supply. We remove individual choice. Lawrence rates this as having low ethical justification.
Which brings us to the technological fix. It's easier to engineer the bread than to fix the social infrastructure. Okay, let's hit the third case study. Mandatory milk fortification with vitamin D.
Lawrence treats this one as a solution searching for a problem.
Because vitamin D comes from the sun.
Right. If you have a deficiency, it's largely a lifestyle issue. We spend too much time indoors. Or an environmental one. It is not fundamentally a food issue.
So fortifying milk is trying to fix a sunlight problem with a dairy product.
Correct. And alternative policies like encouraging sunlight exposure or just taking a supplement are safer and more ethically justified.
But the dairy industry pushes for it aggressively.
Because it adds value to the milk, it gives them the health halo we talked about.
So when you look at these three together, the pattern is obvious. The system consistently produces these technological interventions, adding a chemical rather than social interventions like improving overall diet or reducing poverty.
Because adding a powder to flour is scalable and it's commercially viable. Eliminating poverty is disruptive.
Yeah, it's the path of least resistance. And that leads to Section 4, persistence. Why does this keep happening? Once you start down this road, is it possible to stop? Like if a country decides they don't want fortified imports anymore, can they just say no?
This is where the institutional rigidity really shows itself. The short answer is no, not without a massive fight.
Because of the World Trade Organization, the WTO.
Yes. Global trade acts as the enforcer here. The WTO has two specific agreements that lock this in, TBT and SPS.
Let's break those down. What is TBT?
It stands for Technical Barriers to Trade. It basically mandates that a country's regulations cannot be more trade restrictive than absolutely necessary.
Okay.
So you can't just ban a product because you don't prefer it.
And SPS.
Sanitary and phytosanitary measures. This one says that any health measure you impose must be scientifically justified based on international standards.
And what is the international standard for food?
The Codex Alimentarius.
The global HOA. We're right back to the beginning.
We are. Because the WTO recognizes Codex as the benchmark. If a country deviates from Codex, say, they want to ban imported flour that contains synthetic folic acid, they can be sued for creating an illegal trade barrier.
Let's play this out. Let's say I'm the president of a small country. I say, I don't want imported flour with these synthetic vitamins. I want my people eating our local fresh cassava. I ban the import. What happens to me?
The exporting country, usually a massive agricultural power, takes you to the WTO dispute settlement body. They point to Codex and say, this flour is recognized as safe globally. Where is your massive, peer-reviewed scientific proof that it's dangerous?
And if my small country can't produce a multi-million-dollar study to fight them?
You lose. You face trade sanctions, and you are forced to open your markets to their fortified product.
So national sovereignty and nutrition policy is effectively crushed by global trade rules.
It creates a massive chilling effect. Countries don't even try to fight it because they know they can't afford the lawyers or the science. The trade regime forces compliance.
That is terrifyingly rigid. But there's another feedback loop Lawrence mentions that keeps this going. The medical model. Biomarkers.
Yes. How do we measure if a fortification program is successful? We look at biomarkers. We test the blood.
Did serum folate levels go up?
Exactly. And if they did, the program is hailed as a massive victory.
But that feels so reductionist.
It is. You can have a population that is still living in abject poverty, still highly food insecure, and subsisting entirely on ultra-processed, low-quality staple foods.
Right.
But because their blood tests show higher iron or folate, the donors are happy. The funding is renewed.
It completely obscures the reality of their diet. It paints over the rust.
And that measurable success reinforces the institutions. Groups like the FFI and GAIN, their entire existence is built around this model. Lawrence notes that the current and future trend is just expansion.
Fortify, fortify, fortify.
Right. More nutrients and more foods. Because the institutional machinery isn't built to fix agriculture or address poverty, it is built to do exactly one thing: fortify.
Which brings us to the final piece of the puzzle. Section 5. Interconnection. How this all nests together. We need to look at the ethical architecture here.
The core ethical debate Lawrence highlights is autonomy versus paternalism.
We touched on this with the mass medication idea. Mandatory fortification removes consent.
It does. If it's in the standard bread supply, you can't opt out. The question is that a necessary public health protection, or is it nanny state overreach?
Well, we treat water, right? We put chlorine in the water supply to kill cholera. How is this different?
Lawrence points to the principle of proportionality. With chlorine in water, the threat is immediate death from a waterborne pathogen for anyone who drinks it. The benefit is universal.
So the infringement on choice feels proportional to the threat.
Exactly, just like with iodine and salt. But with folic acid, you are medicating 100% of the population to prevent a condition that affects a tiny fraction of pregnancies, and you're introducing uncertain long-term risks, like the cancer progression we mentioned.
The proportionality completely falls apart.
It does. And it reflects a broader shift that Lawrence is highly critical of. We have moved from a social and community development approach to a medicalized treatment approach.
That's a profound shift in how we view human life.
A social development approach says, people are malnourished because they are poor. We need to ensure access to diverse food, clean water, and health care.
It addresses the root cause.
Right. But the medicalized treatment approach says, the food system is broken, people are poor, so let's just inject the missing molecules directly into the cheap, staple foods they can afford.
There's a quote from the source that stuck with me on this. The solution should most obviously be driven by a preventive public health approach. Yet waiting until there is an acute problem does seem to be the norm.
Because treating the acute problem is profitable, which connects us to the political economy of food. Fortification firmly situates nutrition inside the industrial food system.
Explain that connection.
Think about the logistics. You cannot easily fortify a decentralized local food system. If you buy grain from your neighbor and grind it at a local village mill, nobody is adding a precise microdose of synthetic vitamins to it.
Right, because they don't have a $50,000 dosing machine.
Exactly. Fortification requires centralized processing. It requires massive roller mills and huge dairy conglomerates to achieve the scale and precision the regulations demand.
So by mandating fortification, the government is essentially regulating small, local producers out of existence.
Yes, it inherently marginalizes fresh, local, non-industrial food systems. We have built a global framework where it's literally easier and more legally sound to add synthetic vitamins to highly processed junk food than it is to ensure people have the land and money to eat a diverse, fresh diet.
We are subsidizing the poorest diets with chemical additives and calling it a public health victory.
That is a structural reality.
So we've gone through the design, the incentives, the outcomes, the persistence, and the interconnection. And now we have to pull all of this together with the core analytical question of our show.
Let's do it.
What is the crisis in perception here?
When you apply the systems-level analysis Lawrence provides, it becomes very clear. What is being misperceived is the nature of the intervention itself. We perceive food fortification as a purely benevolent, scientific public health intervention, a miracle cure for hidden hunger.
But what structural layer is obscured by that?
The governance and trade architecture. We fail to see the WTO, the Codex Alimentarius, and the corporate lobbies that actually dictate these policies. We miss the fact that these are very often commercial strategies disguised as health policies.
Why does that surface interpretation fail us? Why is it dangerous to just look at the dropping deficiency rates and celebrate?
Because it treats the symptom, the lack of a specific molecule, while completely ignoring the disease. The real disease is poverty, food insecurity, and the loss of dietary diversity. If we only look at biomarkers, fortification looks like a success.
So how does this systems-level analysis change our visibility?
It shows us that we are engineering a food supply that actively requires industrial processing to be nutritious. We are effectively locking ourselves into a dependency on the industrial food complex. And worst of all, these technical fixes distract us from the much harder, necessary work of social and agricultural reform.
We're basically making the food system safe for poverty rather than trying to eliminate the poverty.
Exactly. We accept a compromise baseline.
That is a remarkably sobering thought to end on, but it is exactly why we do this analysis.
It's vital to see the whole board.
Crisis in Perception examines how systems shape belief and how better tools help us see clearly. This project is free and publicly accessible. If you'd like to support the time, tools, and research behind Crisis in Perception, you can become a supporter on Patreon. For a shorter visual overview of this topic, see the mini explainer linked in the description. If you enjoy this kind of systems-level analysis, please like, subscribe, and comment with books or topics you'd like us to explore next.